here. Okay, so and you know that the supplemental motor cortex, what it does is that it will help modulate or modify the impulses coming from, kasi it's an association cortex. It will help modify or modulate the impulses coming from your Brodmann area 4. So here at the superior frontal gyrus, it will most likely help modulate the impulses for your arms. Here, it will help modulate the impulses probably for your eyes. And I will again expound on that later on. So this part, 44, will most likely help modulate the impulses for what? Your lips and your tongue. And that is what is motor speech. Okay, so there. So again, let's go back. This is your pars triangularis. Everything in front now becomes your orbital part or your pars orbitalis. You have a clear clue there. You should be able to appreciate a depression here. This is your orbital depression. Okay? So this is where you find your eyeball. Anyone here who was a psych major? Anyway, when I used to teach psychology, I enjoyed pointing this out because there was such a thing in the olden times, 1940s, 1930s, it was quite popular. They, for psychiatric patients, for patients who were hard to control, what they would do is transorbital prefrontal lobotomy. So, through your orbit, transorbit, through your orbit, they will insert a probe, okay? And eventually, once you hit something relatively soft, they just destroy it. So it's and they know that what happens there is that the patients now become less aggressive. So it was very popular. As a matter of fact, in the 1930s, the sister of JFK, Rose Kennedy, underwent transorbital prefrontal lobotomy. So what that implies here is that if you read the books on biopsychology, they always say if you know the lesion, then you will know, you will then know the function. So clearly, the prefrontal area is more for behavior and aggression. Okay, so whereas I've explained to you, Broca's area will be more for motor speech. So now let's go back. Six. Then you have here your superior frontal sulcus, inferior frontal sulcus. So Brodmann area 4, Brodmann area 6. Anterior to Brodmann area 6 will now be your Brodmann area 8. Brodmann area 8 is your frontal eye field. Okay, what does your frontal eye field do? It is for conjugate movement of your eyes. So if your left eye turns to the left, your right eye will also turn to the left. Because if it doesn't turn at the same time, you'll either be duling or banlag. Okay, so cross-eyed or
semi-cross-eyed.
or whatever. Now and again, it makes sense. Go back. What would be the part here for Brodmann area 4? Most likely your eyes, if you remember Hal. That's why again, the modulatory aspect there would be for the movement of your eyes. Okay. Now let's go to your temporal lobes. So again, I said everything below your lateral fissure becomes your temporal lobe. Very similar to your frontal lobe, you will have a two sulci. You will have your superior temporal sulcus. You will have your inferior temporal sulcus. Now, and again, they will divide your temporal lobe into 3. Your superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus. Okay? We'll go back here later. Okay, now. Let's go back. This is your central sulcus of Rolando. So everything posterior to your central sulcus of Rolando will now become both your parietal and occipital lobes. So now, what would be the demarcation? Because clearly, after your central sulcus becomes your parietal lobe, what will be the demarcation for your occipital lobe? Okay, on the lateral surface, it's not very obvious. If you're to look on the medial surface, you have a very distinct parieto-occipital sulcus. But on the lateral surface, it's not very obvious. So, whereas your central sulcus is very obvious on the lateral surface, if you look at the medial surface, it's almost indistinct already. Okay, so just that. So, from here to here becomes now your parietal lobe. Okay, now, your parietal lobe will you will have a horizontal sulcus found within your parietal lobe. So what's the Latin word for within? So like, diba, in Manila, there's this city that is found within the walls. So intra. So you now have an intraparietal sulcus. So you have a sulcus within your parietal lobe. Your intraparietal sulcus will now divide your parietal lobe into two, whereas both your frontal and temporal lobes are divided into three. Your parietal will be divided into two. The one above it is now your superior parietal lobule. The one below it is your inferior parietal lobule. Okay, so what's the difference between a lobule and is that it's composed of two or more gyri. For your superior parietal lobule, I cannot teach you two gyri. But for your inferior parietal lobule, we should be able to identify them. So what would be the first? Very easy. Go look at your lateral fissure. You follow your lateral fissure, it will go up. There. You have brain matter that will do a U-turn to your lateral fissure. That is your supramarginal gyrus, Brodmann area 40. Okay. Take note, this again is our intraparietal sulcus, so it's found below it. Diba? So dito, it's intraparietal sulcus yan. And then you have here your superior temporal sulcus. Same concept, you follow your superior temporal sulcus as it goes up. And again, you will have a brain matter doing a U-turn around that. That now becomes your angular gyrus, Brodmann area 39. Okay, again, it's below your intraparietal sulcus. That is why it's called the lobule, because for your intraparietal lobule, you have two gyri there. Okay. Written on the board, it's 5 and 7 in magkatabi. If you look at books, this is actually 5, this is 7 here. So and I'll show you why later on. So this becomes now your parieto-occipital sulcus. Everything behind it becomes now your occipital lobe. So before I forget, you have here your frontal pole, you have here your occipital pole. Okay, now, I will explain to you Brodmann areas 17, 18, 19 when we start on the inferior aspect. It's going to be easier for you to understand. Questions so far on the lateral surface? Okay. Let's now talk about the medial surface. So again, let us go back. You have here your central sulcus. Okay. So whereas your parieto-occipital sulcus is very prominent on the medial surface, your central sulcus is almost non-existent on the medial surface. Again, your clue there is you have here the marginal branch of your cingulate sulcus. So this is actually your cingulate sulcus here. Now, before I forget, nakalimutan ako. Wala ba nag-remind sa akin? Hindi. Balikan natin. Kalimutan ko siya. Brodmann area 4, right? Central sulcus, Brodmann area 4. You again have a gyrus immediately behind your central sulcus. So what do you call that? Post-central gyrus. Brodmann areas 3, 1, and 2. This is your primary somatosensory cortex. Okay. And again, you will have now a sulcus behind your post-central gyrus. That becomes your post-central sulcus. Okay, so it's not that difficult. So again, just know your landmarks, then the wrinkles actually make sense. Okay, so let's go back here. Okay, so this again your central sulcus. Okay, so now you will notice that again, this is your precentral gyrus on the lateral surface. This is your post-central gyrus on the lateral surface. However, on the medial surface, can you still call this your precentral gyrus? Can you still call this as your post-central gyrus? And that would be unfair because you don't have a complete demarcation. So rather than calling it as your pre or post-central gyri, they now call it, what is yung surround in Latin? What is the prefix for surrounding? Okay, so you have now a structure that surrounds your central sulcus. So it is your paracentral lobule. Your paracentral lobule, it's called that because it's composed of two gyri, both your pre and post central gyri.